Good morning. We had tightened on our precautionary measures on 8th of May, but we have seen a significant increase in community cases. In the past week, there were 71 locally transmitted cases. Most of them were linked to previous cases or clusters, but we had 15 unlinked cases in the past week. This is worrying as we are not able to identify the source of these infections. It means that there are undetected cases in the community. We have cast a wide net and taken swift actions to detect, isolate, and ring-fence any possible emerging transmissions. Close contacts are under quarantine, and some of them may turn positive over the next few days as they may be incubating the virus. We are in a state of heightened alert. I would urge everyone to be vigilant and minimize unnecessary social interactions. We need to act decisively to disrupt the virus transmission. We will therefore further tighten safe management measures in the community. Higher risk settings, in particular where there is a high density of people who are unmasked for prolonged periods, such as dining in, will not be allowed. Work will continue, but working from home will be the default. Minister Lawrence Wong will provide more details on these additional precautionary measures shortly. We are in a different situation from where we were about a year ago when we imposed a circuit breaker. In the past year, we have built up our testing and contact tracing capacity, as well as roll out our vaccination programs to manage community spread. Testing in particular is one of our key defensive tools to quickly identify individuals who have been exposed to the virus and reduce chances of further spread. We have been conducting active surveillance and routine testing of targeted groups, as well as testing for those diagnosed with acute respiratory infection. To speed up the detection of cases, we will also begin using antigen rapid tests for all who present themselves with ARI symptoms at our swab and send home public health preparedness clinics, or PHPCs, polyclinics, hospitals, emergency departments, and regional swab centers. This is in addition to the polymerase chain reaction or PCR tests that are already being done, and this will give us an early result within 30 minutes. This enhanced testing regime will be rolled out progressively, starting with about 200 SESH PHPCs from 15th of May, and will be expanded progressively. Both the ART and PCR tests will be funded by the government for all individuals with ARI symptoms. There will be bumps in our journey to recovery. The additional precautionary measures that we are introducing today are necessary to protect Singaporeans and keep our loved ones safe. We must respond and act quickly to overcome these bumps. Each of us must also play our part. Let us continue to practice social responsibility for the collective safety of all Singaporeans. We have managed to lower our transmission numbers before, and we can do it again. So let us take heart and press on with the fight. I'll now ask Professor Kenneth Mark, our Director of Medical Services, to give a quick update.
Thank you very much, Minister. It's too early to give you detailed reporting of case numbers and the cases that we picked up today. This will come out in the press release that we will issue later this afternoon and in the evening. However, I will make a few general comments to paint the situation that will come out in the press release. First of all, we will be reporting an increased number of imported cases that come into Singapore over the last day. And these are related to, in part, the rising situation that occurs in the other countries of concern, particularly from the Asian subcontinent. There's also some reporting that's taken place as a result of tests being held back through a little bit of bunching that's taken place previously. But I do note that a lot of these cases were also reflecting the increased trend, particularly for these travelers coming out from India, Pakistan, Bangladesh, in countries in that particular region. We continue to see cases that are being reported from the cluster associated with Changi Airport. The majority of these are staff members as well as household close contacts of staff members from Changi Airport. They were picked up as a result of either some symptoms that some of these members had or quarantine testing, and these were from individuals that are already within our quarantine net and therefore reflect testing of people that already are on our radar. The cluster in Changi Airport is also being managed with aggressive testing, and Mr. Ong will be sharing a little bit more about some of the measures that the airport is taking in this regard. For Tan Tock Seng Hospital, we are reporting one additional case, bringing the total number of people affected by this particular cluster to 44 in total, and this will be reported in the press release later today. This additional patient was in quarantine, and we have not to date had any cases being reported outside the quarantine net that we had cast for close contacts associated with the cluster arising in Ward 9D. We are reaching one incubation period, and if we continue not to see any other cases beyond those that are already in quarantine, we may work with the hospital subsequently to see how to bring the hospital back to normal operations progressively over the next few weeks. In the press report, you will see also mention of a few students in schools that had come out. At this point in time, epidemiological investigations are still ongoing, but most of these students are in fact linked to one of our cases that was reported yesterday, case 63131. And this is a tutor in a private tuition school that had symptoms and subsequently was tested positive for COVID infection. And these students were picked up as a result of epidemiological investigations and testing while they were being placed under quarantine. But further information will come out in the press release as we continue our epidemiological investigations. The public is advised to continue to be vigilant and to monitor themselves, particularly if they had visited Changi Airport from the 1st of May onwards. And if you are now having symptoms, for example, fever, respiratory symptoms, or even a loss of smell or taste, we encourage you to step forward, get yourself tested, and you can register for tests at our regional swab testing centers. The SESH clinics and PHPC clinics may also provide testing, but the majority of tests would be available at our regional swab testing centers. And this will help us to pick up any other emerging cases early and allow us then to bring the cluster associated with Changi Airport better under control. We should continue to be vigilant during this time as we tighten our community measures. It is important to continue with our regime of mask wearing, safe distancing, and personal discipline in our own infection control and hand hygiene. And this will allow us then to see through the community cases that we have and allow us to bring this further under control. Thank you.
I'll now ask Minister Ong Ye Kung to give a quick update on the airport situation.
Good morning, everyone. Some update on the Changi Airport cluster. The men and women at our Changi Airport, they have worked very hard over the decades. I think brought a lot of pride to Singapore and Singaporeans, but now they are facing probably their biggest challenge since Singapore became independent. First is because of COVID, the entire aviation is decimated. They are serving now less than 3% of pre-COVID passenger traffic, and really the bare bones to keep Singapore connected to the rest of the world. And these are really talking about families reuniting, Singaporeans, PRs returning home, workers, students going overseas for overseas posting or overseas studies, key officials, businessmen, investors coming or going out to get deals done or supervise significant investments. So really the bare bones. And now they are hit with a COVID cluster. They have been on the front line, risking their own safety day in, day out for the past 16 months for a task that is entrusted upon them. And I think they really did their best. Don PPE, they observe safety precautions, put themselves through regular testing, 14 days, some 7 days, when vaccines first came out and Singaporeans were uncertain or jittery about vaccines, they decided to take the plunge first. And today, more than 90% of them, the front line, has been vaccinated. But unfortunately, this mutant virus, very virulent, it broke through the layers of defense. Changi Airport, they have plotted the first 20 over infections they have detected and found that they are quite congregated. Most, in fact, congregate around one zone. And this is the zone with a finger pier that receive higher risk countries' arrivals, including South Asia, and then the conveyor belt and immigration. So it's that whole zone. And infections were all around that area. So that zone is our equivalent of Ward 9D, like Tan Tock Seng Hospital. And from that zone, workers go have their lunch, go have their meals at the T3 basement 2 commercial areas and the food court. And we suspect from there, it transmitted to members of public that visited the place. So the first worker case was detected 6th of May. From time to time, we do detect one case here, one case there. So on 6th of May, together with MOH, we did contact tracing, testing, quarantine. But on 8th of May, MOH detected the student who was infected after visiting Terminal 3, Basement 2 food court. So immediately the next day, we took action, closed down the entire commercial area in T3, Basement 2 for deep cleaning. And then we started special ops with MOH to test 9,000 workers in T1, T3, plus Jewel. And since we are testing Jewel, we also decided close Jewel for 2 weeks as a precaution. So as of last night, 7,641 has been tested. Almost 6,000 results are out. 6 were positive, and these 6 were detected in the first 2 days of the special ops. Lately, in fact, they have not been positive. What is noteworthy, 500 workers in Jewel has been tested, and results are out, and so far, all negative. However, this is one group. There's another group of workers who are close contact with earlier infection cases, so they have been in quarantine. They too are being tested, and so every day, past couple of days have been 10 cases. I think yesterday was 13 cases were tested positive, and this is the number that have been contributing to our community cases that has been reported. Of all the workers in Changi Airport, 28 of them infected. Majority, in fact, 19 of them, they have been fully vaccinated. And the last I checked, all are well, and no one is on oxygen. So we are cautiously hopeful that the airport worker cluster, just the worker cluster, hopefully can be contained through quarantine and testing, just like what has happened at the seaport and Tan Tock Seng. The airport has since tightened up measures, in fact, rethought through the entire concept of operations and operating around the concept of segregation. So now the airport will have higher risk zone, lower risk zone. I just visited them this morning. And if it's higher risk zone, the workers are cohorted. So if you work in a higher risk zone, you stay within that. You are donning full PPE, category 2 now. Cleaners, in fact, category 1. And you consume your meals, will be catered within the zone. You consume your meals within the zone, you don't come out. So it's a concept of segregation that they have started to implement. And the big worry now is now the onward community transmission coming out of the commercial area in T3B2. And that is why we are announcing this series of measures today. So I hope we continue to give our support to our airport workers as you have done for our hospital workers. They need all the support we can have, we can give them now to keep things going and to keep our airport surviving. And we need to have each other's back. Thank you.
Good afternoon. I said earlier this week in Parliament that Singapore is going through a knife's edge where the pandemic is concerned and that cases can go either way. I think we have seen in the last few days that our efforts to move in quickly to trace, test, and isolate infected cases have been effective, and they have helped to bring some of the recent clusters in Tan Tock Seng Hospital and Pasir Panjang Terminal under control. But since then, we've also had this new and very worrying cluster in Changi Airport emerge. You've heard just now from Minister Ong the efforts and the measures that we have taken to control and ring-fence these recent cases. I think by and large, we are able to do so for the staff and workers in the airport. What's more of greater concern to us is that there are many people, many members of the public who would have visited the airport in the last few weeks. They would have gone to the commercial areas, and it looks like a number of them have become infected. For example, in the Terminal 3 Kopitiam, where they were there, probably masked off, dining, and they probably had been infected by fellow diners who were also there. We are also concerned that there may be hidden cases that would have leaked out into the community, and we are unable to detect them. And that's why in recent days we have also seen a rise in unlinked cases emerging. We have taken actions to close the airport to the public, to ring-fence these cases, but because we do not know how far the transmission has occurred into the community, we do have to take further, more stringent restrictions. And therefore, we are tightening measures significantly in the community in the following ways. First, we will reduce the permissible group size further from up to 5 persons currently to 2 persons. This will apply across the board. So if you want to go out for anything, grocery shopping, exercise, maximum of 2 persons henceforth. Likewise, for visits to other households, maximum of 2 persons. In fact, we strongly encourage everyone to stay home as much as possible, go out only for essential reasons, and if you have to go out, maximum of 2 persons. Second, we will go back to work from home as the default for workplaces. So all employees who are able to work from home will have to do so. Work from home will be the default. Third, we will take tighter measures around the higher risk settings. And these higher risk settings are the ones where people are gathered together in an indoor environment without their mask on. We have already taken action to restrict such activities in the gyms and the fitness centers earlier. We will now also take actions with regards to dining in at food and beverage establishments. So all dining in will have to cease. This will include hawker centers and food courts, both indoor and outdoor. All F&B establishments will only be able to offer takeaway and delivery options. In line with this, wedding banquets will also have to cease because it's a dining activity. Next, we will also reduce activity and event sizes. Previously, we said generally you can do 100 without pre-event and the PET, pre-event testing, and up to 250 with pre-event testing. We will scale all of this back. So you can do 50 without PET and up to 100 with PET. And this will apply to congregational and worship services, as well as to MICE activities. Likewise, we will reduce the capacity limits across the board for shopping malls, showrooms, and attractions, as well as cruises, museums, public libraries. All of these capacity limits will be scaled back. These measures, I've just given a summary of some of the key measures that we will be implementing. Full details will be in the statement. The measures will take effect from Sunday, 16th of May, and will continue for 1 month through to Sunday, 13th of June. We will do a review at the midway point, meaning 2 weeks after the measures have been implemented, and at that point we will look at the prevailing public health situation and see if there is a need to adjust the measures further. We realize that this will have significant inconvenience to many people. I think the businesses that will be hardest hit will be the F&B sector because of the restriction for dining in. And so in view of this new restriction, the government will increase the job support scheme support rate, the JSS support rate, to 50% for F&B firms, and this will be an increase from the 10% support for which is applicable today. This increase in support will be applicable during the period for which dining in is prohibited. At the same time, to support hawkers and coffee shop stall holders who are self-employed and do not benefit from the job support scheme, the government will provide 1 month of rental waiver for hawker stall and coffee shop tenants of government agencies. We also strongly encourage commercial landlords to support their F&B tenants during this period. We know that there is one group who will be particularly impacted too, which are wedding couples. Some of them may already have wedding plans for this coming Sunday, and it may be very hard to make last-minute changes. So if there are such couples who are impacted, we are prepared to consider grandfathering the arrangement just for the wedding couples who have already made plans for Sunday. They can proceed, but we will require them to put in place pre-event testing for all their guests. But this is a special arrangement only for this Sunday because this is a once-in-a-lifetime event for the wedding couples. The changes are coming in very soon and may be hard for them to change, so we are prepared to consider this only for this Sunday for wedding couples. I think we know that this is a very difficult period for everyone. This is clearly a setback in our fight against COVID-19, but we are resolved to keep fellow Singaporeans safe and to see Singapore safely through this crisis. So let's continue to stay united, to support each other, and do our very best, all of us, to keep cases down and get through this hump together. Let me just say a few words in Mandarin. 各位中午好。通过追踪及大规模的检测，最近出现在陈土生医院和巴西班让码头的感染群已经控制下来。不过，我们相信樟宜机场感染群已扩散到了社区。由于社区内可能有暗藏的病例，我们决定采取更多的行动，以防止社区病例继续扩散。我们将采取更有针对性的管理措施，尤其是在一些比较高风险的场所，比如那些人们在室内会近距离接触，而且会把口罩拿下来的地方。我们之前已经在健身中心采取了管制措施，接下来我们将不允许人们在餐饮厅用餐，这包括小贩中心和咖啡店。所以餐饮店只能提供外卖服务。同样了，为了避免人们 拿下口罩在外用餐、婚宴也不允许。我们也会进一步限制聚会人数，从5个人的顶线减少到2人。如果人们要出去买东西，最多也只能是2个人。同样的，如果必须探访其他人，探访的人数也只能限制为2人。我们也回到居家办公为既定模式，能够在家办公的人都应该那么做。这些措施将从5月16日生效，直到6月13日。我们在采取措施的2个星期后，将进行检讨，看是否需要调整。我们必须支持那些保护我们的前线人员，而最好的方法就是认真遵守安全管理措施。人人都应该负起责任，防止病毒的传播。而当轮到你的时候，也应该尽快去接种疫苗。这次的病毒的扩散的确是一场挫折，但是我们要确保新加坡能安全度过这场危机的决心并没有动摇。让我们继续团结合作，控制疫情，一起度过这个难关。Finally, let me just wrap up my comments with a few words on the cases that we have seen in school-going children. We've had a few of such cases where students in school have been infected. Up to now, all of these infections have taken place outside of the school. Whether it's a recent case with the VJC student, or more recently, as you heard from DMS just now, it looks like there are some students who were also infected by the tuition center teacher that was reported yesterday. These cases will be highlighted in today's press release later on. So the infections took place outside of school. We have a series of very tight measures to pick up and to detect and to ring-fence our school system. For example, the first ring of defense will be the close contacts, and then the second ring will include, if necessary, swabs of everyone in the school, staff and students. And we have done that recently in Edgefield Secondary as well as in VJC. Up to now, there is no evidence of transmission within the school system. But we will continue to monitor this very closely and see if additional measures are necessary. In the meantime, we have already tightened up all the safe management measures in schools. We have reminded our principals and teachers to be alert and vigilant and make sure that students who are in our schools can continue learning safely. I think what's very important during this period is, again, we should remind everyone, so long as you feel sick, you are not feeling well, please do not go to school, do not go to work, report sick, go and see a doctor immediately, and in the meantime, isolate yourself. We have seen from recent experience and the recent cases when the people do that very promptly, they are able to limit the spread of the virus. So it doesn't go on to other settings. It's confined to themselves and maybe to 1 or 2 other people in the household. And therefore, it stops the spread of the virus very quickly. On the other hand, we have seen cases where people feel sick, they are sick, they may even have a fever, but they continue going to work and only see the doctor later on. And unfortunately, when this happens, the virus would have spread to many other people, be it at work or in other settings. So it's really critical for all of us to do our part. Anytime we do not feel well, see a doctor, isolate, and get ourselves tested. Thank you very much.
Thank you. I'll now invite questions from the media.
Dear Ministers and DMS, thank you so much. Dear members of the media, please be informed that the press statement has been issued. Kindly note that a final version from MOH will be issued after the press conference. We will now begin the Q&A segment. Dear members of media, please remember to use the raise hand function on Zoom if you would like to ask a question, and a gentle reminder to keep to one question per media only. If you're called upon, you will be prompted to unmute yourself, so please do so accordingly. May we have the first question from Ray from Straits Times.
Hi, Ministers. Thank you for the information. I'd like to ask, in view of the growing cluster of cases at Changi, as well as the closure of schools linked to the private tutor, there's been a lot of concern, I think, about the seniors in the cleaning company, as well as the young students. So can you please tell us, what do you see as Singapore's major missteps or weak links that got us into this situation with the escalating situation, and how significant is the role of the new variants that were imported into Singapore into these clusters? And in view of the measures that we've just announced today, do they not amount to a lockdown or a circuit breaker? And why are we still allowing worship services? Why are we not closing up borders? What would it take for us to consider these measures? Thank you.
What we have seen so far from the recent cases suggests, as we have already highlighted, that the mutant strains, the new strains of the virus are more infectious, and the risk settings where infection can take place are when people are in an indoor environment without their mask on. And that's why we are focused on tightening restrictions in such a setting. As I explained, we had already done so earlier for activities in the gyms and fitness centers where you are unable to keep your mask on. And now the next step, as we have highlighted, is to restrict such activities in F&B establishments, and therefore no more dining in. In other settings, outdoors, or when you are in a space but you are able to keep your mask on, we believe with safe distancing, with proper precautions and safeguards, these activities can still continue. But we would like everyone to take the measures seriously and scale back their movements, scale back their social interactions, because as we keep reminding everyone, it's usually in social interactions where you let your guard down, you visit a friend at home, you take off your mask, and in such instances, if someone is an asymptomatic carrier, the infection will spread. And therefore, we are also taking a step today to reduce group sizes from 5 to 2, and we call on everyone to stay home and only go out for essential activities. We believe these later sets of measures are already very stringent, and if everyone cooperates and we all do our part, we will be able to bring down the latest clusters and cases and bring the infection under control. So we have put in place a package of measures which we believe are strict and necessary, and will be able to arrest the latest spike in cases so long as all of us do our part.
I should perhaps add that this is part of our journey to recovery, because every now and then, when there is outbreak, we have to review our measures and we need to tighten as we go along. And when the infections come under control, then with an opportunity to roll back some of these measures, open up the economy, open up the community, so that people can begin to also socialize and interact with one another. But every now and then when we see the cases go up, we will have to tighten, we have to roll back. And this is what we are doing now, to roll back in order for us to make sure that we are able to keep the clusters under control and to prevent the further spread of the virus.
Thank you, Ministers. Gentle reminder to members of media to keep to one question per media only. Next, can we have Tzu Peng from Cao Bao?
Hi, good morning, Ministers and DMS. This is Tzu Peng from Cao Bao. So if the situation does not improve significantly after 2 weeks, does that mean our next step could possibly be another round of circuit breaker? And also some confirmed cases earlier on, they already had symptoms such as fever. However, they were not immediately swabbed. Instead, they were only swabbed a few days later. So is there a gap in our testing regime that needs to be plugged, and hence the implementation of the ART? Thank you.
So on the first question, indeed, as I've said, the latest measures will be implemented from Sunday and will take effect for a month. We will do a review in the midterm 2 weeks later. If indeed the situation does not improve, we certainly will not rule out even more stringent measures thereafter. But there is also a chance that things may improve, and therefore we may also consider the other way around, easing some of the restrictions. So the midway point is really meant as a point for us to review. By 2 weeks' time, we would have been under this heightened alert for 3 weeks, because we started already earlier, reducing group sizes to 5 and raising our safeguards in some other settings. So we'll monitor and we will review the situation 2 weeks later, and as I said, at that point in time, we will adjust the measures where necessary, depending on the latest assessment of the public health situation then.
On the testing, traditionally we have relied on the PCR tests as the gold standard because that's the most reliable. But PCR test has its own limitation. It requires laboratory services, and laboratory work will take time. And sometimes the results may be equivocal and we need to retest again to confirm the outcome. And that takes time, usually maybe between 1 day or 1.5 days. And in some circumstances, when it is, the results are uncertain, it may take up to 2 days. So therefore, we decided that instead of waiting for the PCR test, we will introduce the ART test. The ART test will allow us to have a quick result within 20 to 30 minutes. However, we also know that ART tests may not be very sensitive. So we therefore want to make sure that if there are positive cases, we will have to retest it. And for those that are tested with ART, we will take another sample to send it for PCR tests so that we can confirm whether it is positive or negative. So there's additional tests that we are going to put in place. This will allow us to speed up the initial results. So if we are able to detect the positive cases earlier, even if they are maybe false positives, because ART is less specific. If they are false positive, we can verify with PCR. But in the meantime, once we have a positive result from ART, we can start the contact tracing and ring fencing and quarantine of close contacts. That will allow us a head start in terms of our ring fencing of the infection. But that is also premised on the fact that those who have symptoms will come forward early. Because even if we are able to shorten the testing time, if the patients only present themselves to our healthcare institutions 1 or 2 days later, that negates the entire effort of trying to shorten the testing period. And therefore, like Minister Lawrence Wong mentioned just now, it is important for all of us to be mindful that once we see a symptom, once we feel unwell, please don't hesitate to go and see a doctor, and we will test you. And at least if it is negative, it gives you peace of mind. If it is positive, we can help you and give you the necessary treatment as early as possible, and also to start contact tracing and ring fence the infection to protect your loved ones and your friends as well.
To provide some additional detail, in addition to what Minister has mentioned, we're also working with the labs to expand their capacity. They are doing a certain number of tests, but they actually have some reserve capacity to scale up as well. We are working with the labs to make sure that they have that capacity available in case we actually need to ramp up our testing given the outbreaks that we're dealing with now. We will also be working to expand our quarantine facility capacity in order to be able to accommodate the potential and future demands associated with bringing all these clusters under control. So we're working at multiple ends to make sure that we will be proactive and we will be able to scale and manage these outbreaks decisively.
Thank you, Ministers and DMS. Can we have the next question from Deborah from Channel News Asia?
Hi, good afternoon, ministers and DMS. Thanks for taking my question. So given the spike in community cases, there's even more urgency now to achieve herd immunity. Would you then consider making vaccinations mandatory? Thank you.
At the moment, we are still continuing to encourage our Singaporeans to get vaccinated. As I mentioned earlier in Parliament, I'm encouraged to see the progress of our vaccination. Particularly, we are more concerned among the older populations, those aged 70 and above. We need to continue to reach out to them. But it's also important to bear in mind that we cannot rely on herd immunity to protect us, because we do have to expect that there will still be a certain number of people who cannot be vaccinated because of medical conditions. And on top of that, even with the vaccination, we can see that while it protects us against severe disease outcome, it doesn't totally stop infection. It also may not stop transmission altogether. So we also mustn't run away with the idea that once we are able to vaccinate everyone in Singapore, we are safe, and therefore we can do away with all kinds of precautions. I think vaccination has to be seen as part of a plethora of tools that we are putting in place to protect Singapore and Singaporeans. Safe distancing measures like those that we introduced today remain very important, very critical part of our defense against infection. In addition to that, contact tracing, ring fencing, testing, and so on are part and parcel of this whole suite of tools that we are going to deploy to protect Singapore and Singaporeans against COVID-19. So vaccination is one of these tools, and we will continue to encourage Singaporeans to sign up.
Thank you, Minister. We will now take the fourth question from Kyong Hee, Bloomberg.
Hi, thank you very much for taking my question. I wanted to ask, given the spike in the cases and the measures that are being placed until mid-June, does this mean that the travel bubble that's supposed to start on May 26th, is that going to be affected by this new set of measures that are being implemented? And if so, when can we see this sort of restart again? Or is this going to be delayed until after probably we get out of these latest measures that is being put in place? Thank you.
Yeah, let me take that. Yeah. First of all, I think let's recognize Hong Kong is a very safe region now. Like us, they do tens of thousands of tests a day, and they are picking up often 0, if not 1, 2 cases a day. So it's a very safe region. The issue now is the situation in Singapore, where cases are going up. So I spoke to Secretary Edward Yao this morning. Yeah. I briefed him on the Singapore situation. We both agreed that we are strongly committed to this air travel bubble between these two international cities. We also agreed that we therefore have set a target date of 26 May to launch the ATB because of our commitment. But at the same time, we have to start it safely, and that we must respect the resumption mechanism that both sides have agreed on. So the assessment is, given the rising cases in Singapore, it is very likely that Singapore will not be able to meet the resumption criteria. So what we will do now is closely monitor the numbers next few days, critically review the start date, and early next week, we will make a decision and make an announcement on the Singapore-Hong Kong ATB. Yeah.
Thank you, Minister Ong. We'll have the next question from Chen Lin from Reuters.
Good evening. Good afternoon, ministers and DMS. So while we are on the pace with having enough vaccines for all by the year end, is there any scope for us to accelerate our program? And if we are unable to accelerate the program, why is it so? Thank you.
Thank you. As I mentioned in Parliament earlier this week, our supply of vaccines remain the main constraining factor. And we are continuing to explore additional supplies, alternative supplies, and also continuing to assess various new vaccines that have become available, and we will see whether or not we will be able to introduce additional supplies and additional vaccines. And if we are able to do so, then we will probably are in a position to accelerate the program. If not, we are still on track to complete our vaccination by the end of the week, by the end of the year.
Thank you, Minister. We'll have the next question from Siti Aisha, Berita Harian.
Hi, Minister. Thank you for taking my question. With the further reduction in the permissible group size to 2, are there any exceptions to this, like maybe special arrangements for those with special needs, for example, those parents with more than one child, if they need to send the child to school or childcare by the same parent, or maybe any elderly or special needs individual who needs more than one caregiver when they're out? Are there any exceptions to this?
Well, we know that. Thank you for the question. We have been through this before in the, even last year when we had similar restrictions, and we recognize that there are instances where families have childcare arrangements. So in such instances where the grandchildren is being cared for by their grandparents on a daily basis, then this would not be counted towards the cap of 2 distinct visitors per households. So that's something we will allow, particularly when the grandparents are caring for their grandchildren on a daily basis. But other than this, once again, really this restriction and this cap is really for everyone's safety. So we just ask Singaporeans and everyone in Singapore, remember the reason why this is in place. It's not about, we have had to make these adjustments before, and we are able to do so again. The best thing now is to reduce your movement outside of home significantly, work from home as much as possible. If you want to go out, do it at maximum, not more than 2 persons.
Thank you, Minister. We'll have the next question from Janice from Today.
Good afternoon. Thank you for taking my question. Earlier, Mr. Gan, you talked about how vaccination is among a plethora of tools, along with safe distancing measures, contact tracing, in Singapore's fight against the COVID-19 pandemic. So my question is, since elimination of the virus doesn't seem to be possible, so is there some sort of strategy going forward from this point where, we have to live, between, since elimination is not possible and we have to, it seems as if living with the virus seems to be the only way, unless, vaccination rates increased to 90%. So I'm wondering, is there a third way going forward in terms of the overall strategy of exiting from this pandemic? And also, what conditions need to be met before the government deems it necessary for a second circuit breaker? Thank you.
Thank you. As I explained, I think vaccination is also part of our important strategy going forward to protect ourselves. But it is not the only tool that we can rely on. We have to rely on the whole slew of measures. And we also expect that it is going to be quite difficult to totally eradicate the virus. It's almost impossible to do that. Then we will have to learn to live with it. So what is a possible scenario going forward in the long term? So how do we deal with it? One possibility is that if we are able to vaccinate the vast majority of Singaporeans, then the most of us are going to be protected against very severe outcomes. So you may be infected, but if your outcomes are not severe, then we will be able to provide you sufficient medical support to ensure that you survive, you recover, make a full recovery, and life goes on. And that is all. And in addition to that, vaccination also helps to prevent transmission. May not be 100%. The extent to which it prevents transmission is still a subject of scientific studies, but it does seems to be able to help to reduce the extent of transmission, and therefore that will allow us to reduce the number of cases that we see from time to time, and that will allow us to better control the infection outbreaks. And therefore, in combination of all these factors as well as measures, it will allow us to restore our community and our economy to normalcy as much as possible with vaccination and with a certain amount of safe distancing measures that we can put in place. So this is something that we will still continue to have to observe and to see how it evolves. Bearing in mind also that from time to time, you are also likely to see new variants emerging, and therefore we will also need to assess whether or not booster shots may be necessary in time to come. So these are uncertainties that we are confronted with, and we will discover more about this as time goes on, and we may need to adjust our strategy going forward. But I think in the meantime, we ought to focus on rolling out our vaccination program and implementing the safe distancing measures that we have proposed today.
On the second part of the question, a week ago, we entered into a set of measures that effectively, as we described it, brought us back to phase 2. Today's measures go beyond that. It's really a much more stringent and robust set of measures to tighten up, restrict movement. So it's really phase 2 and beyond. It's a heightened alert posture that we are taking. We will continue to monitor the situation going forward. All the indicators that we've talked about, whether it's unlinked cases, the assessment of how widespread the virus has gone into the community, the results from our continued surveillance and testing of symptomatic individuals, these are all in place and will give us a good assessment over the coming days and the next 2 weeks whether the situation is improving or whether things continue to deteriorate. And as I said, if the situation does not improve, we will not hesitate to take further measures. Ultimately, it also depends on everyone's response. So again, we call on everyone in Singapore, cooperate, do your part to cooperate with the measures, abide by the rules, and with this latest, a very robust set of measures, we have a chance of being able to bring the cases down and control the infection.
Thank you, Ministers. Can we have the next question from Ling Zi from Wan Pao? Sorry, Ling Zi, but we're not able to hear your audio. Could you please speak up a bit?
Can you hear me now?
Yes, much better.
Okay, great. Good afternoon, Ministers and this is Ling Zi from Alianha Wan Pao. My question is on the tuition center cluster. Is there any indication that the teacher was only wearing face shield instead of masks, and students from different schools were, eating and mingling in class without wearing masks? So will there be any tightening measures targeted at tuition centers and enrichment centers? Or MOE will consider an early June holiday for all school students like what we did last year? Thank you.
Thank you very much. Concerning the question about face shields, we are reviewing the mask policies that we had, and together with the press release that we are issuing today will be also a tightening of the mask regime, and further information will also be provided in the MOH website that we have. In short, we are strongly encouraging the use of masks instead of face shields in these settings where previously in class scenarios we've allowed face shields to be used. The mask that we recommend would be 3-ply masks that can be either of the reusable version or surgical mask, and these masks should not have filters or vents, and these would be the strengthened mask regime that we would be encouraging the public to adopt.
So in line with what DMS said, all the schools will adopt a similar posture, which is that we will no longer use face shields as a substitute for mask wearing. Teachers were all, which we had up to now allowed, although in fact the vast majority of teachers already have been using masks. Right? But going forward, we will tighten and require all teachers to wear surgical masks when they are teaching. And we will, as I mentioned, tighten all the necessary safe management measures in schools. Based on the evidence so far, as I said just now, we've looked at all the cases, we've tested students, we've tested close contacts. There's no evidence of school-based transmissions because the students who have been infected got infected outside of the school setting. But we continue to monitor, we continue to keep our schools as safe as possible, and we will review the position depending on the latest situation, and if there is a need, we will not hesitate to take additional measures.
Thank you, Minister and DMS. We'll take the next question from Mayuko from Nikkei.
Good morning. Thank you very much for this opportunity. I would like to ask, MOH have
sorry, Mayuko, but we can't hear you
some
clearly.
of the cases so far in this way
Hi, Mayuko. Sorry, could you repeat your question?
have been tested. Hello, can you hear me?
Okay.
Wave. Some of the cases are tested as.
Hi, Mayuko. Sorry,
Can't hear.
Mayuko. Could you please repeat your question from the start?
Okay. Well, in MOH have announced so far, some of the current cases are tested as the Indian variant of B1617. But not all. What is your assumption? Do you assume that most of the cases in this current wave are of this variant? And if that is the case, are you in an understanding that this variant are able to transmit even if you are masking up and wearing the PPE in some of the cases in a hospital or Changi Airport? So do you have to think even tighter measures? And also, do you assume that this variant, particular variant, are the ones that can evade the antibody of the vaccines, current vaccines?
Thank you very much for the question. We perform phylogenetic testing for all our cases now, but that takes time, and because of this, we do not have the phylogenetic data for the more recent cases that we've announced over the last week. But this should come soon, and once these are made available, we'll be able to say with more certainty whether or not these cases are definitively due to particular viral variants of concern. However, that said, for the early cases that we reported in relation to the Tan Tock Seng cluster, as well as the Changi Airport cluster, the Tan Tock Seng cluster is associated with the B1617.2 strain. The Changi Airport cluster, the early cases, the provisional test suggests it may be one of the 617 variants, but for us to be able to type this with more certainty, we require the formal phylogenetic test results to come out. At this time, we are concerned that these variants do not behave similarly to the cases that we had seen last year. Certainly, we have in the hospital cluster some individuals who were wearing masks and personal protective equipment who had got infected. At this time, the assessment is not that they were lax in their compliance with these PPE regimes, but were placed in settings where where there may have been exacerbating factors. There may have been a very high viral load, and there may have been issues with airflow and ventilation, which may have exacerbated spread of the virus to susceptible individuals. That said, the vaccine has mitigated a lot of this concern with the cases arising. But even then, we have seen some cases arising even in vaccinated individuals. So we are reviewing the entire posture that we have, starting with our hospitals, but also then extending to other sectors in terms of what additions or improvements to our PPE posture need to be taken in order to better protect our frontline workers in the different settings where they may be at increased risk of being exposed to infections, or in particular to individuals infected with these viral variants of concern. But more information will come out as the phylogenetic test results come out.
Can I just add a couple of points? As I was mentioning just now, the airport worker clusters, great majority are vaccinated for 2 doses. And so far, none require oxygen, and we really hope it will stay that way. And that includes those which are a bit more advanced in age. Second fact is that we are still studying how the virus transmitted. But I was mentioning that we have an equivalent of Ward 9D at the airport. The workers are masked up, PPE and all, but we need to do further studies. But there are also possibility that it transmits, say, through toilets and through eating. And through the use of the food court at the commercial area, we did notice Singaporeans public that go in there do get infected when masks are off in that kind of setting. So studies are ongoing, but the facts do point towards vaccination helps, mask, PPE helps. But as DMS mentioned, the studies are still ongoing.
Thank you, Minister and DMS. We will now take the last 3 questions. So the 10th question next will be from Stefania Palma from Financial Times.
Hello, can you hear me?
Yes, loud and clear.
Perfect. Thank you. I just wanted to ask, in terms of this jump in cases, new clusters, jump in unlinked cases, how does this impact some of the conferences coming up, technically coming up in Singapore, including the Shangri-La Dialogue and the World Economic Forum in August? Are these going ahead? What needs to happen for them to go ahead and for them to not go ahead?
Well, we are in touch with the organizers of all of these events. These are international events, so they will also involve travelers from around the world. And the event organizers, therefore, will have to assess both the public health situation globally as well as the prevailing situation in Singapore. As far as the Singapore side is concerned, we are in touch with them and we will provide them the latest information on our prevailing public health updates and the cases, the measures we are taking, so that they have the latest information to decide on the events. But the organizers will also have to take into consideration the broader public health situation and whether or not some of the potential attendees of these events are prepared to travel. So for these events, I think the organizers are monitoring the situation both globally and in Singapore very closely, and they will provide updates in due course.
Thank you, Minister. We will now take the penultimate question from Hui Min, CNA Digital.
Yeah, thanks for taking my question. Just wanted to ask about the business fallout from, the 1 month of closure for F&B. Do you expect it to be as bad as what happened with the circuit breaker last year? I think a lot of F&B owners are already suffering from that. So was just wondering whether we expect the fallout to be worse or comparable to what we saw last year. Thank you.
Well, it's hard to predict what will be the fallout or put a precise assessment to it. Certainly the F&B sector will be impacted. The takeout business is not the same as dining in. and therefore, while they can shift to takeout, there will be an impact on their revenues and bottom lines. And that's why the government is stating upfront that we are providing an enhancement of the job support scheme for F&B establishments during the period where there is a restriction on dining in, and for the hawkers and the stall holders, coffee shops, we will provide rental rebate insofar as the government is the landlord. So we will continue to monitor this closely, but we believe with the support measures we can do something to help the affected businesses.
Thank you, Minister. We will now take the final question from Indu from Tamil Murasu.
Good afternoon, ministers. I'm Indu from Tamil Murasu. Are there going to be any measures to limit crowd in public transport? And with the new measures, crowd will reduce, but there's still no contact tracing in this. And also, will there be active testing for the commercial areas such as Little India?
I'll take the public transport question. Yeah. From Sunday and next week onwards is work from home by default. So we do expect the public transport commuter volume to fall further. Before this series of additional restriction measures, we are running at about 70% of pre-COVID. Into CBD is in fact lower, maybe 50 plus 60%. But we have been running public transport frequency as if it was pre-COVID, basically at pre-COVID frequency. So where there is some crowding, we are monitoring it very closely. LTA is monitoring very closely. Where there is some crowding is often at a particular station at a particular time, and then one station later, it disperses. I take the Circle Line, for example. So at Buona Vista, there can be a bit more crowd. Once you reach the next station, it disperses. And by the time I reach Labrador, it's quite quiet, even during peak hours. So these are the settings that we are talking about. Transient, a bit of crowding at 70% of pre-COVID volume. But what is important is that refrain from talking, keep your mask on, and be assured that the air ventilation within the train is actually very good. And excluding the opening and closing of train doors, every 6 minutes, all the air is being replenished. So with good ventilation, refrain from talking, keep your mask on, and LTA and the public transport operators running the train frequencies normally like pre-COVID, I think we can keep public transport very safe.
On your question on testing, we are indeed scaling up testing, and we will continue to do more of it. We are doing this from a risk assessment point of view. So each time we identify a place, a venue where potentially many people may be exposed to an infected case, then we will go down to that particular venue and do a special operations where we would get everyone there who had been to that place tested or invite them to get tested, as we have been doing recently in the airport, and we will continue to do in other venues where we see an infected case and potentially a high number of possible exposures. Because our basic approach is to cast a very wide net, test as much as possible so that we can flush out all the likely hidden cases in the community. So if you look at where we are today, once again, just to summarize, we are testing, tracing as much as possible and doing everything we can to move in quickly, ring-fence cases in the community. That approach has worked. It has been able, so far up to now, to bring down the cases in the Tan Tock Seng Hospital cluster as well as the Pasir Panjang Terminal cluster. We now have a new cluster in the airport which we are dealing with, and potentially some leaks from that cluster into the community. And that's what we are urgently trying to control. And because there is uncertainty as to how far the leaks have gone into the community, we've decided to heighten our posture, raise our alerts, and then have a much more stringent set of measures during this phase, and therefore all the new restrictions that we have put in place. We are also continuing, as you have heard just now, to do as much as possible with our vaccination program. And if we all do our part, over the next few days and weeks, we have a chance of bringing the cases under control. So again, we remind and call on everyone to cooperate, stay home as much as possible, work from home, do not go out. If you have to go out, do it only for essential reasons, and keep your group size to not more than 2 people. I think if we follow all of these new guidelines and rules, we will be able to bring down cases and get past this hump.
Thank you. I may just want to add that we also continuing with our roster repeat testing for our frontline workers. That will also give us a sense of the prevalence among our workforce of COVID-19 cases. And we also, MOH also regularly mount special testing projects to target at specific settings where we feel that there is a high risk of infection, to give us, again, a sense of a surveillance, give us a sense of what is the prevalence rate like in these settings, to give us assurance that if there are any cases, we will be able to pick them up early. This is an ongoing work, and we will continue to adjust our testing strategy to respond to the prevailing situation. To conclude, I just want to remind all of us that these measures will come into effect on Sunday. But for all of us, please be vigilant, even today, tomorrow, before the rules come into effect. If we can avoid unnecessary social interaction, stay at home as much as you can. If you can work from home even before the rules kick in. So this is to protect ourselves and to protect our loved ones. If we work together, we'll be able to bring these clusters and these community cases under control as quickly as possible. Thank you.
Sorry, if I may, one more piece of nagging. If you have been to Changi Airport from 1st of May, please step forward and get yourself tested, which is what Professor Kenneth Mark have mentioned. But I think I seek the help of media. Let the public know.